most of the discomfort in about a week or so, but in terms of some limitations that I put on you, between 4 and 6 weeks.
4 and 6.
Yeah, you're going to start feeling pretty good in a couple of weeks, but the breast can remain swollen for between 4 and 6 weeks. So when you wake up from surgery, you're going to have a bunch of dressings on.
Okay.
Remember, the scar pattern is going to look like an anchor, so like that. I'll also do some liposuction right over here on the
sides.
Part. Yeah, just on the sides, just to help contour that. And then the drain, if I use one, will come out right over here at the end of that incision.
How long if I need the drains would I have them?
Typically a week.
Okay.
So there'll be a bunch of steri strips. You know what those are?
No.
It's like a Band-Aid, little medical tapes.
Okay.
This is exactly what they look like. But I put those all the way around the nipple areolar complex, and those are going to stay on for probably close to a month. If they're not off by about a month when you come in for your 1 month visit, we'll take all those off.
Okay.
If they come off, it's okay. I just put them on there. The rest of the incisions will have dissolvable stitches, but you won't see them. They'll all be buried underneath the skin. The only stitch that you would see if we put a drain in is going to be the one holding the drain in place.
Okay.
Keep it from falling out. You'll also have, actually in this drawer right here, you'll wake up with something like this on you. Okay? And I'll just try to remember to ask you what kind of bra you wear. But it's basically like a tube top. This is just going to wrap around you. And that's going to be your initial bra, so to speak, for the first week. And then when you come in here for that first post-operative appointment, because I'm going to see you the day after surgery.
Okay.
Which will be a Saturday. And then the following Thursday.
Where would I see you at here?
Right here in the office.
Okay.
Yeah. I'll give you all that information on that day and what time and all that. Where do you live?
Bremerton.
Not far from here?
No.
Okay. And at the 1 week appointment, we'll put more of a bra on you. Janie will fit you with one. So it's going to something that's going to zip and clip in the front and adjustable shoulder straps.
Okay.
So it'll fit you a little bit more, but they're designed, they need to be snug. Again, because the breast will swell, it's going to try to maintain some compression on there.
Okay.
Some people call it the Iron Maiden, and for some people it's uncomfortable, others love the thing. So,
how long will I be down for? Just a day or two, or?
Yeah, actually, I want you up and moving around. That's one of the reasons why I have you come in the day after surgery, just to kind of force you to get up. You're going to be a little groggy, probably from the anesthetic, but otherwise you're young and healthy. So. A couple of days of, feeling a little beat up. But most of the patients are taking the pain medication for the first 4 days or so, routinely, just trying to stay ahead of it. After that, it's usually just in the evening.
Okay.
You're sore before you go to bed.
All right.
Okay?
Yes.
All right. Well, I'm going to get your prescriptions.
And you said you'll give me a list of things, of like what's going to happen for that day?
Janie's
she will? Okay.
Yeah, she'll kind of be able to go through that. I'm going to get your prescriptions for you. I'm going to give you 2 prescriptions. One's going to be for pain medication, and then the other one is going to be an antibiotic.
Okay.
Okay. And you can, military?
Yes.
So you can go over to the Navy Hospital. You've got plenty of time. Run over there to their pharmacy and pick that up beforehand. That way they're at home, so as soon as you get home, you can start taking them.
Okay. But don't take them until after the surgery?
Yeah. You're going to get a dose of antibiotic in your IV the day of surgery, and then you'll start taking the pills when you get home.
Okay.
Okay. It says every 6 hours. You don't have to wake up at night and take one. So take one in the morning when you get up. Take one in the evening before you go to bed. Find some time during the day to kind of spread the other 2 doses out.
Okay.
Okay. We're not treating an infection. We're prophylaxing.
So we're trying to prevent one?
Correct.
Okay.
All right. Any other questions?
No, that's all.
Okay. So here's this, Janie. I'm going to go get her prescriptions.
Right. And it's an 8:30 start that day, so she's first patient, so it's just checking on. And so they usually get you there a couple of hours ahead of time.
Okay.
Yeah, they'll tell you when to be there. I guess I have a meeting that morning before the surgery.
Okay.
So I will see you before the surgery. I'll have you stand up. I'm going to do all the drawings, put all the marks on you, so because when you lay down, everything changes.
Okay, and what kind of medicine is the antibiotics and the pain medicine?
The pain medication is oxycodone.
Okay.
So if you've ever taken Percocet before?
I think I have before.
Yeah, it's basically Percocet but no Tylenol.
Okay.
So it's just the narcotic component. And then the antibiotic is Keflex.
Okay, I don't think I've ever had that.
Okay.
All right.
Yep, and you don't have any allergies. So,
No.
So should be good.
Okay, thank you.
Okay. I'll be back in a couple minutes.
All right.
Okay, I'm going to go and make a copy of this. I'm going to give you a copy. I'm going to send one over to the hospital. And what time is your appointment over there?
I think it's at 11 or 11:15.
Okay, we'll
So I still have some time.
Yeah, go. Okay, and then you're going to see him the next day here.
After the surgery?
Mm-hmm.
Okay.
So that's on Saturday. And you come in the back door, and you'll see his black truck out there in the car park where you parked today.
Mm-hmm.
And we call it the back door, but it's not on the same side as you came in, but it's just before you get to the steps.
Okay, so
To
just
go
before I
over
get
to
to the
the
steps?
hospital. Yeah, so just park there, ring the doorbell, and we'll say 8 o'clock, but he might change that on Friday when he sees you. He might say, oh, come at 9, but we'll put you down for 8.
Okay, for Saturday.
And then
Can't authorize refills have to be done each time.
Okay.
And then the other one is the antibiotic. Again, there is a refill on here, and you only need to take that if I tell you to, okay? Or to get it refilled. But I want to just have you start taking those right after surgery.
Okay.
oh, they're different total weeks.
Yeah, I don't know what they changed, but this is how they print it out instead of having one. So, I don't know. Suzanne's trying to call them right now. So if they have any problems with this, just call me and I'll clarify it with them, okay?
All right.
Take a listen to your heart and lungs. No recent cold or flu-like symptoms?
No.
Okay. Did you have a good Christmas?
Yes, it was pretty good.
Okay, nice deep breath. Okay, nice big one. In through the nose, out through the mouth. Good. Just relax and breathe normally. Everything sounds good. You got all her information. You got your prescription?
Yes.
All right. We will see you then next Friday morning.
Okay.
You'll be the first victim on the list.
Okay.
All right.
And you said be there a couple hours early?
They'll tell you
They'll tell
exactly
you
when.
exactly
Oh, okay.
today, but
Can I go to the appointment today?
Yeah.
Okay.
probably be there about 6:30 arrival, because you're the first one.
Okay.
Get cracking on you.
All right. And these are the appointment times that I have?
Yeah, you don't take any of your medication until after surgery, until you get home.
Okay. I'll probably fill the prescription this coming up week then.
Yeah, that's a good idea. And then loose, comfy clothing, something that buttons up, does up the front.
Okay.
And Dr. Mix will be putting a binder thing on you, like
Okay.
a tube top.
And then
The
for
prescription I gave you. I'm going to make a copy of that stuff and show them all these.
for pants, just like some sweatpants.
Yeah, sweatpants, and then just a big baggy, warm, think of warm, easy to put on shoes.
Okay.
And slippers. Some people even go in their dressing gowns and
Okay.
pajamas and things. Just think of something easy. You don't want to be going like this afterwards.
Okay, so
And
don't
then-
reach my hands above my head or anything like
No.
that. Don't reach.
Drink lots of fluids the day before surgery.
Okay.
Then nothing by mouth after midnight. All your jewelry off.
All right.
And do you have a belly ring or anything
No,
like that?
thank you.
Okay, so you're fine for that. And then sort of practice a couple of days before moving your legs around.